Hey there, Rob. How are you?
Hey, Max.
Good to see you.
You hear me okay?
I can hear you perfectly. Can you hear me all right?
Yeah, my camera seems to be a little fuzzy, but
Yeah, it all depends on the light, I find. That's why I have mine turned off right now, simply because if I turn on the lights in here, all of a sudden I'm look like I'm on fire. Um, and with the lights off, it's like you say, it gets really fuzzy. So I'm gonna hold it like this until I need to speak.
okay. Forgive me. I may not have all the material. I was going to text you. I didn't see an agenda there. Was there one?
Yeah, there was, but I
Okay.
can resend that to you. It's only the one item, Rob. It's just
Okay.
discussion in light of Salem's movements towards mask mandates and that sort of thing. And Rich just wanted to have a conversation to update what's going on here and what the board would like to do moving forward. That's all.
Okay. Yeah, I got that, and I also got your updated cases that you sent out today.
Yep. Okay, great.
But I didn't. You know what? I didn't print out is the questions that was it Frank that wanted to know what we were doing with city meetings and so forth.
That all was just a framework, honestly, to
Okay.
for points of discussion. None of some or none may be discussed. So we'll let Rich kind of lead the discussion and chime in from there.
Okay. And you
So,
said city council is going to be joining us?
city council, no. Well, I mean, members may, but not that I'm aware of. But
Oh,
the mayor's office was invited as always, so they may be in attendance. And just so you're aware, too, we're being recorded as we speak.
okay.
So, all right, I'm going to bow out at the moment.
Yep.
And I'll be back.
All righty. See you soon.
Yep. And just so you're aware, Rob, you're not muted.
Oh, I'm glad you said that. I was just running down.
Greetings, Fred. Good to see you.
Can't see you.
Sorry. Yeah, you know what is the video on this is a little wonky. So, and really, is the world prepared for this much gorgeousness? No, I don't think so.
That's my line.
Oh well.
Tick, 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 tick goes the clock. Yeah. Oh, dear. Thank you for this remarkable collection of questions.
Well, things to ruminate about. I mean, we'll see how,
It's been
yeah.
very helpful. I've taken the test 3 times and my answers have not changed. Because a lot is subjective. It's very, very helpful bit. Thank you.
Okay, you're welcome. I'm glad it helped in some way. Okay. And I apologize, I forgot to put concerns of the board on the agenda. It was in such a rush. But obviously the board members can bring up whatever comes to mind. I actually haven't been out of the building all day today. I'm guessing it's really hot.
92, 93, something like that.
Oof.
95% humidity. There's a
Oh,
machine.
excellent.
There's a
I always
machine
wanted
that
to,
tells you this.
I always wanted to live in Southeast Asia. This is great.
Oh, you didn't.
No, I did not.
There's a story about a family who lived in Southeast Asia in the 1840s, Americans. They went kind of native. Well, somebody came from the home office, so she went to open her trunk to take out the proper clothes and whatnot. There's nothing but dust in the bottom. Creatures over 20 years had eaten everything.
Oh, I bet.
Paper. There were belt buckles. They ate the leather. Oh, what a life. No. No, thank you.
No.
Florida's lovely for 2 weeks in February. That's it.
Yeah.
Yeah.
All right.
Are you air conditioned?
I'm sorry?
Are you air conditioned at home?
Yes, thankfully. The 3rd floor, oops, let's see. I apologize. It looks like Rich came in as an attendee. Let me see if I can promote him here.
Hey, Joe.
Hello, all.
There we go. Joe, how are you, sir? There's Rich. All right, Rich, I just promoted you as a panelist, so you're back again.
Yep.
There he is.
Yeah.
Goody. Is Rob got a screen? There
Oh,
he is.
he's there.
There he is. You're on mute, Rob. There you are.
Hi, all.
Good.
Rob. So I just saw the latest BioBot report, Max.
Oh, right. And forgive my ignorance, Joe. What's your interpretation?
It's gone up again. So it's
Right.
2 consecutive. It went, there was a tiny blip, it went down, and now 2 consecutive readings has gone up.
What's
Yeah.
it now? I've seen it at 100 and something.
Yeah, it was 192 or something. I don't have it in front of me, so I don't know.
Another 50.
And it was, the previous one was 92,000. This is now 100 and something, 120.
Mhm.
I don't know. I can't.
Yeah, it does reflect the slight uptick we've had in numbers, although they've remained relatively consistent and some people will be coming off soon. So we'll see what happens.
Still one person in hospital?
Correct.
Can you?
Max,
Go ahead.
on that report, do they ask whether or not they've been vaccinated?
It is one of the questions I can say, because it's more than 5, that 14 of the people were actually vaccinated, 7 were not. And then I think 1 was unknown or something like that. Yeah.
Say that again, Max.
So 14 of the people were vaccinated and 7 were not. And then I think there were a couple of unknowns. They were trying to, there's been some back and forth between us and the state trying to figure out how some people are not listed in the system, but Cindy's on it. So I think they'll get it worked out.
A lot of them are not listed in the system.
Yeah, I've been hearing some rumblings, but yeah.
What was that, Fred?
Probably another minute or two.
Just that there are a lot of people in the city who are not in the system.
Oh,
deliberately. Hello, Bobby Orlando.
hi, Bobby.
It's Claudia.
Good. There you are. Hello,
Hi,
Claudia.
Oops. I was having a little computer problems, so I'm using my iPad. I think it'll work okay.
Okay, should we get started?
Sure.
This is a meeting of the Gloucester Board of Health. This meeting is, August, what is today? August 12th, 5:30 PM. And this meeting is virtual. This meeting is recorded by video and audio in accordance with the state open meeting law. Pursuant to section 20, chapter 20, Acts of 2021, this meeting will be conducted by remote participation. The public may not physically attend this meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. Additionally, all votes taken by the board during this and future remote meetings will be by roll call vote. If you are calling in on a phone, you can press *9, request to speak. If you're watching on a computer or device, there is a hand raised button that you can tap or press to request to speak. Please use either of these options during all communications to be recognized to speak. The listing of matters is those reasonably anticipated by the chair of the board, which may be discussed at the meeting. Not all items, in fact, may be discussed, and other items not listed may be brought up for discussion to the extent permitted by law, and the order of the agenda may be modified at the board's discretion. Okay, we're done with that. We will start with introduction of the members of the board and staff. I'll just call out names. Max,
Max Schenk, Interim Director for the Health Department.
Fred,
Fred Cowan, member of the Board of Health.
Joe,
Joe Rosa, member of the board.
Rob,
Rob Harris, member of the board.
Claudia,
Claudia Schweitzer, board member.
Bobby,
Bobby Orlando, recording secretary.
and I'm Rich Sagal, the chair of the board. Next, we will have public oral communication. This is an opportunity for anyone in the audience to speak up for up to 3 minutes on any item not listed on the agenda.
Mr.
Is
Chairman,
anyone so raising their hand or hitting *9?
Mr. Chairman, could I ask, please, that we add to the agenda concerns of the members at the end?
Sure.
Thank you.
Oh, yeah.
Yeah, I apologize. I mentioned earlier that in the rush to get everything done for the meeting that it had gotten skipped, but it wasn't intentional, believe me. And Patty Page has her hand raised in the audience to speak.
Okay, Patty, you may speak for up to 3 minutes and Max will be the timekeeper.
Go ahead, Patty.
Hi, Patty Page, 3 Tidal Cove Way in Gloucester, and I appreciate this opportunity again. I thank you that the mosquito control policy issue will come up in September 2nd's meeting on the agenda, and I hope you'll give me some deference here because I know the rules. I can't speak at that meeting, so I'm going to try to give you some background here for that meeting to come up. The state is in the middle of a 2-year process of drafting legislation which will change the mosquito control policy across the state. We saw that with that opt-out application that you all supported, and I appreciate that very much, and so do others. But that should be an indication to you, a big indication of what is now happening. Prior to this 2020 legislation, there was no need for us to do that. We weren't a member of the mosquito control district. We had control over what we did or didn't do in our community. That's no longer the case. The state now has said you will be under the state mandate. So given that, I'm just here to reiterate the importance, and unfortunately, I know everyone has, big things plates that are full, but this is mosquito season now. So the importance of getting the city engaged and involved in some of these things now is crucial, because if we miss this seasonal window, we can't, back up and say we complied November and December. That's not probably how this is going to work. Since the April opt-out application, I've attended all the state task force meetings. So I'm pretty ingrained in this process. The approval letter that Gloucester received specifically states, despite approval, there remain substantial opportunities for improvement in all plan submissions this year. And what they're, relaying as best I can see from all the evidence I've gathered is they're looking for regional cooperation, source reduction, a very robust public education program and process, data collection and analysis, and efficacy assessment. Now, I don't believe any of the communities around the Commonwealth are prepared to do most of that. But what I'd like to try to impress upon you is if we can just touch on some of the low-hanging fruit, which I think is regional coordination. Both Rockport, Gloucester, and I'm hearing Beverly opted out. We should be communicating with those communities, trying to pool ideas and resources. Source reduction. I hate to put anybody on the plate, but maybe our DPW could just go around and do some, culvert maintenance and things and try to get that as a proactive measure. Just really easy things to be accomplished right now, because we're going to need next year to show the state that we really can take this on ourselves. Because if we don't, they will tell us how they're going to move on it. I just really feel that the city, whether it be the Board of Health, the health director, or some city official, needs to engage at the state level. There's lots of communities I'm engaged with now, and
I apologize, Patty, the 3 minutes is up. I'm so sorry.
I appreciate that. I've sent you the information. I'll send it to you again, Max, and I appreciate the opportunity for September 2nd. But I know you're taking this seriously. I appreciate Claudia's comments, Fred Cowan's mentioned, and we'll just see where this can go. And September's September. So thank you.
Thank you, Patty.
Thank you.
Thank you.
Anyone else, Max?
Nope, that's it.
Okay. We will close that portion, move on to approval of minutes. Are there are no minutes to approve? Is that correct?
As far as I know.
Okay. And any committee reports?
Nope.
Nope. Okay. We'll move on to the reason for this actual meeting, which is COVID-19. I felt that it was important with all the things that are changing, what communities are doing around us, that we should have a meeting to discuss this and not wait till the regular meeting or even a week and a half. And I appreciate everyone making themselves available for this extra meeting. Max, you want to update us?
So I think what really prompted this discussion is the fact that Salem, a combination of the Mayor Driscoll's office and the Board of Health, looking at the uptick in numbers, and also I think primarily with the, looking ahead at the October events that take place in Salem, which can be rather crowded and rather busy, wanted to start taking some measures to put in place now to get people prepared for that. And so the board voted, I believe, last night that requiring all city buildings and public buildings in town, meaning businesses, be required to have masks. And I believe, trying to remember what else, that the schools, they're requiring that the students and staff at the schools also be masked. So there were a number of other recommendations made, asking people to do various things and asking the state to provide targeted wastewater surveillance, extending the stop the spread testing, and forgive me, working with municipal school employees to require COVID-19 vaccinations or twice weekly negative testing. And adopting a similar vaccination or negative testing requirement policy for their employees. I don't have the latest information as to whether or not that was part of the decision put forward last night, but those items were on the table. So the question is, does Gloucester Board of Health want to follow suit in some form or fashion? I've sent the most recent numbers that we have of cases in town. Currently, we're at, goodness, what did I say, 24 active cases and 1 in the hospital. They were 14 unvaccinated people, 7 were, no, excuse me, 14 vaccinated, I apologize, and 7 unvaccinated people. So, and what I'm sure everybody else has heard in the news lately is that regardless of vaccination status, people should be wearing masks when inside. The CDC guidelines should be wearing masks when inside in public spaces. It's just a good idea. The Delta variant, because it's so virulent, can be spread and be carried by people who are vaccinated. And the beauty of the vaccination, though, and it's been proven, is that it prevents people who develop the virus from suffering the worst effects, and most certainly prevents them from, mostly prevents them, I shouldn't say completely, but mostly prevents them from being hospitalized from severe effects. So I think that's the message that really the board needs to send out there. And the department has been doing their best to do, as the administration has been. But the question remains, does the board want to move forward in working with the administration to produce a plan for masking in our public buildings, city buildings, and what happens with the schools now that the school year is coming up. So thank you, Joe, who's offered to join me. We've been asked to come to a school committee meeting to discuss this. The Department of Elementary and Secondary Education is going to be providing an update on their policies and procedures for the school year. Sometime we're hearing is either going to be late this week, which this is late this week, or early next week. One of the things the board can consider in that deliberation is whether or not we wait to see what DESE's guidelines are going to be, and if the board is adamant that for the protection of staff and students and everybody's families, if DESE, which is the acronym, if DESE decides not to move forward with a mask mandate, that the board, using their authority under the state codes, move forward with a mask mandate of their own. So that's one issue. And then obviously working with the administration for the public buildings themselves and the staff.
Thank you, Max.
So Max, is there, I ask this out of ignorance, I shouldn't be ignorant about it, but I am. And that is there a form, is there a formal mechanism by which the city can send out strong recommendations, or the board for that matter, or the health department, saying, highlighting and making people realize that this pandemic is not over. We've had, I actually blew up the one that I had last chart. You know, we had these 3 or 4, depending on how you count them, blips in virus. And the thing on the end here is what's happening most recently. You can see that it's still very low, but it's going up. And so, you know, that we should be taking that seriously, and people should be raising their vigilance. And when they're indoors around people of unknown status, such as in a supermarket, for instance, it should be recommended to them that they wear a mask. Whether, we go the next step and mandate it is, there's a whole ball of wax associated with that. But
So I have,
there's an intermediate step that we take with strength.
oh,
What am I hearing?
I'm not sure.
Claudia, are you frozen in space or?
okay, yeah, I think I'm can you hear me now?
Yeah,
Can now, yeah.
Yeah, okay, yeah, I think I'm in my husband's office. It's a different Wi-Fi. I may have to move back to the house, which is, it's not air conditioned. So.
Right now. Were you trying to say something?
What I wanted to know is what the numbers were in Salem compared to here. I know they made that decision based on, October, but do you have any sense?
So I did have a conversation with the Mr. Greenbaum, the agent for Salem, and he said they did have a pretty quick bump of 30 cases. And he said it had gone down. I don't know what the most recent number is, but I spoke with him 2 days ago, and he said it had gone down since then. But it was enough of an instigator for them to, start considering, where now it's August, you have the school year coming up. And then, of course, they start planning for October activities at this point, to just start putting those recommendations out there.
Yeah, and I think, the situation is different in Salem. It's a bigger city. October is a madhouse with a lot of people coming from other communities being cheek by jowl inside in many cases because of the various witch houses and what have you. I think if it was all outside, like we have beaches, people coming to beaches, but outside is much, much safer than being inside. And so, we're comparing apples and oranges, I think, if we compare ourselves to Salem.
Do we know what the vaccination rate of Salem is compared to us?
No, I don't, but I can find that out and send it to the board.
I am totally with Joe on this, that we should put in place strong recommendations so that if our numbers blip, it's a question of really throwing a switch and it goes from strong recommendation to mandate.
Right. Yeah, I think
I'm really more in favor of encouraging people in groups or whatnot for self-policing, which that they feel that they're making an intelligent decision for themselves, following our guidance rather than being told, because then when they're in an environment where there are no rules and regs, they're more likely to follow the same cautions that they would be doing here at home. It's a good teaching tool.
I agree, but I think, so my original question was whether or not we have an established mechanism to make those recommendations in a very public way so that everybody is likely to be aware of them, as opposed to it just showing up in some minutes of some meeting that we have.
Well, it's also the newspaper. Lots of people don't read the newspaper.
Yeah, Max,
So it has to be something like maybe a 911 phone message from the mayor.
that's exactly what I was going to ask for.
That'd be a good idea. Yeah.
Yeah, that's exactly what I was going to ask for.
great idea.
Because she has been stellar all through this, using that telephone system, keeping the community informed.
And people tend to listen to that. Yeah, that's a good idea.
That's a very good idea, Claudia.
There's also a few websites out there that have been going on through the pandemic, helping people that maybe they could get the message out as well.
Yes.
Right,
And
but
just
a lot
to-
of people don't go on computers, don't read the paper, something. And the other thing is, do we want to have a number when it reaches 50 per day that we, institute a mask mandate, or how do we want to think about it?
I think my own opinion is that there are too many moving parts to
Agreed.
find out what the trigger is going to be.
I agree too.
And so I just think we have to use our best judgment. And
Yes.
regardless of what we decide, there are going to be people that complain one
Yeah,
way. So, we can't.
We need to be pushing the value of vaccinations.
I agree.
Sure.
I agree.
So in that sense, that's also something that could be part of the communication in that, is it easy for people between the ages of 12 and whatever it is, 30, where vaccination rate is lower? Is it obvious where they can go to get a vaccine? Do they know?
You know, Joe, I asked that question at the last meeting to get it again published. But I was trying today to help a friend who needed to be tested, and there are no appointments here in the city that I could find. So going to Salem was the answer. And
Testing and getting the vaccine are two different things.
say it one more time.
Testing and getting the vaccine are two different things. You were saying getting tested.
Yes.
Joe was saying getting the vaccine.
Oh, I'm sorry. I misunderstood.
Yeah, I mean, they're both important.
Yeah.
But getting the vaccine is more important than getting tested.
Yeah.
So you're allowed, you can get vaccines at all the clinics now, right? Like the day clinics?
You can also get it at the,
CVS.
yes, exactly.
CVS as
The
well.
pharmacies are carrying it as well.
Okay, so that, just a brief message to that effect to be incorporated in the mayor's. So we should put something in writing for the mayor and she can, tweak it as she wants.
Is
But-
the mayor here tonight in this meeting?
No, she, Frank, and Chris Siguranza, well, she and Frank Chris Siguranza as well, were given panelist invites, but I don't see them.
Because it would be great to have her input, as to whether she wants to do this.
Well, I think providing a recommendation from the board to the administration to that effect, is more than appropriate.
Yeah.
On the school committee meeting, when is that, Matt?
It is the 18th at 7 o'clock, I believe.
Okay, so my opinion is I don't really think I think we should wait for that meeting before we make any recommendations on students and teachers.
Yeah, there's a couple of different things, Rob, just so you know. One is the school committee meeting is separate from DESE's recommendations that are supposed to be coming out. And the question is whether or not DESE's recommendations will include mandates for masking and testing and vaccination, et cetera. I think what we're going to be asked, if DESE for some reason does not provide any information prior to that meeting, we are going to get asked whether or not the board would support such a thing. If that, all things given, I think the board's response, from what I'm hearing, is that should DESE decide not to require masking for students and staff, that the board in turn will, make it a requirement, which is your ability under state legislature or state law.
Oh, did we have a discussion on that? Because
Oh, absolutely.
no, did we have a discussion?
It was brought, forgive me, it was brought up. So we can still have a discussion.
Oh, I must have missed that.
Yeah.
Well, just while we're on the subject, I would not, I don't, at this point right now, I see no reason to have the kids' masks and the teachers' masks at this point. I need to know if it's going to really help or if it's. I've done a lot of research. I have 2 young kids. One's in middle school, one's in elementary school. One's under 10. The other one is 13. And I just, especially for my 10-year-old, I feel like the mask is hurting more than helping them. And my 13-year-old, he goes to the orthodontist and they're picking stuff out of his teeth that are coming from the mask. And I'm not so sure the mask is helping. I think it's hurting them more than helping. So right now, I'm not for the kids, the mandatory masks in school.
I read this afternoon that one of the country's largest teachers unions has declared that all faculty must be vaccinated and everybody when they're in the building should be wearing masks. I don't
I
know.
would tend to agree with that until we can vaccinate the younger kids, that's the biggest accumulation of people who are unvaccinated.
Yeah.
And whether the rates are lower with the variant or not, I think there's still a lot we don't know about that.
Yeah.
But I just think it's prudent for the kids to wear the mask until things get straightened around.
Right. And that is the
Yeah.
drift of this union. So it may be decided for us.
Right, and children are starting to get very sick.
Yeah.
Unvaccinated children and getting hospitalized,
Yeah, even in.
like in Florida, in places like Florida.
You hear in Florida, they just have no more pediatric ICU beds.
What was that, Rich?
You hear in Florida, that many areas have no pediatric ICU beds anymore,
Yeah,
well, full.
Filled up, yeah.
I
So,
know Florida's a different situation with the adults getting vaccinated and all sorts of other issues that make a comparison a little difficult. But I think being on the prudent side, the masking, the recommendation for masking for everybody in schools is a good one until vaccines are available, and then we might look at other options.
yeah, so are vaccines readily available for 12-year-olds and up? Well, for up for sure, but they should be available for 12.
They're available for for kids that are 12 and up, yeah.
I think it's the same
And once-
vaccine.
And once the drug is, the vaccine is formally approved, it'll finally be able to be delivered to doctors' offices.
Right,
Apparently, that's one of the reasons that it hasn't been distributed. Is that emergency status doesn't
Yeah.
satisfy some criteria.
right.
I think that will be really helpful when people can go to their doctors and have a conversation.
So do I.
There was a meeting that I attended, which I was grateful to the mayor for. It was a meeting of regional mayors and with some subject matter experts from epidemiology and one of the hospital systems. And the epidemiologist was adamant about the fact that masking in schools right now is probably and Rob, your objections obviously understood and notwithstanding, is for that population and that age group where the spread is starting to increase in that age group is probably best. Their prediction was, and Fred, to your point, was that the approval should be happening fairly soon for I think it's the 12 plus year olds soon. And then the question is going to be when the approval for 5 to 11 year olds is going to happen. And the prediction on that was sometime in November, December timeframe.
I can tell you that I've been listening to a number of podcasts of various experts talking about this whole issue, and almost unanimously they say if they have kids in school, then they want them to be masked.
Yes. Max, one of the issues that you bring up on this helpful list was some contact sports, where kids are very, very close together, football and hockey and the like. My sense is that anybody 12 and older must be vaccinated if they're going to be playing those sports. What's your thought on that?
I just remember that at the height of COVID, there were issues, but it was mostly in relation to indoor sport events and ensuring proper masking and that sort of thing. Outdoor sport events, but close contact. Yeah, I would. I mean, to be perfectly honest, if you want my personal opinion, based on the experience in the department during this whole episode, why take chances? If people are able to wear a mask as part of their activity, wear the mask.
Yeah.
I mean, there are instances like with that Rob's experiencing, where there may be special conditions and exceptions made or need to be made on a case-by-case basis. But as a general policy, masking is just appropriate for right now. Now, the question is, once that approval for at least emergency level vaccination for 5 to 11 year olds is approved and it is available to 5 and 11-year-olds, do you then scale back based on a certain vaccination number, the requirement for masking? And that's a conversation for the future, I think, but it's something to keep in mind.
But what is your thought about restricting sports in public school to kids who are vaccinated?
I think that may be a slippery slope.
Yeah, I
It'd
do too.
it'd be very difficult to monitor for all involved. I think, the masking is going to be the most important thing and best defense at the moment. And, for 12 plus old youth, the vaccine is available.
That's what I mean.
And so, yeah. And so I think, I think, and again, let's see what the DESI guidelines are going to be, because it may very well include that, because that's what's happened in the past. A lot of that was thrown into it.
I'm really pro-vaccine.
Well,
Sorry.
but as far as sports, I really, hearing, what Rob is saying, we need to bring the parents into this, and their decision. If a parent of an unvaccinated kid wants them to play sports, I mean, then in some ways it may become their decision, or not wear a mask, not in school where teachers and, other kids, but I don't know, in some way, parents have to have some involvement in this decision-making process.
Yes, in behavior for their child, as long as it doesn't affect any other children.
Yeah.
Many employers are taking the option, if you're not vaccinated, you need to have a negative test every week, every other week.
I
Twice a
know,
week.
yeah.
And I know that is on the table, I believe, for the Gloucester school system.
Yeah, but the problem with that is that a test doesn't tell you how you are, it tells you how you were when you were when you were tested. And the concern is the exposure you have that morning. That is not covered by it. Tests shouldn't be used as something that's punitive, or you're. I mean, I can see a restaurateur insisting on a rapid test, and trusting that the odds are in his favor that it's going to be accurate. But to use it by policy, I really do wonder, because there's a time gap between when the person was tested and right now. And you're
I
not
totally
covering that
agree with you, Fred, on the time gap. It's just another way to try to monitor things. If
Yes,
you're going to be testing, you really
It's
should
the
be
best we
testing
have.
every day.
Right.
I
It's
didn't
the
get the
best
last
we
part.
have right now. Right?
Say it again, Claudia?
It's the best we have right now.
Yeah.
I mean, we can't,
Right. It's the best we have. And if you want to really if you want testing to do what you were saying, Fred, you need to be tested every day.
exactly. So that I just don't see testing as being that useful for prevention of infection. For revealing infection, it's very, very useful.
I feel like that testing twice a week, or, different businesses have different testing methods, but I feel like that really is a tool to try to get people vaccinated that aren't vaccinated.
You're probably right, Rob.
Well, I think it is. And I think that people who are against vaccination need to look at the bigger picture. It's not just you. It's not you making a decision not to wear a seatbelt.
Yeah,
That basically affects you and nobody else.
it's driving drunk.
Right. So that the vaccination is a little different because it affects everybody.
Sure. I don't feel like anybody should be forced to vaccinate at this point, whether it be
no,
sports. Yeah.
I don't think anybody's being forced. It just means they might not be able to have the job, that they're on, or they might work remotely, or.
Well, they may not be able to play the sport.
Well, I think
they
that
might not be able to
businesses should be able to decide what they want to do with their employees always, in any aspect.
Yeah.
I agree with you.
Mhm.
And that's where a strong recommendation, like what Joe was talking about, it would be very helpful.
Yeah.
And it's the
I
will.
just-
Go ahead.
I just wanted to get back because I think I was frozen. Max,
No.
I wanted to
We're not hearing you.
Breaking up,
Yeah,
Claudia.
Claudia, you're breaking up, sorry.
Uh,
You've broken up and your image is frozen.
21 people and 14,
Claudia, why don't you turn
Uh,
off your camera?
can you hear me now?
It comes and
Okay.
goes. Why don't you turn off
I'm
your
gonna go
camera?
I'm going in the other, I'll be right back.
Okay.
Uh,
We'll save your seat.
Is that better? Is that
Yeah.
better?
Yeah,
I'm gonna
Yes.
go I'm going back to my house.
that
Okay,
was quick.
it was better?
Yes, now it is.
Yeah,
It
it's
is, yeah.
fine now.
It was better, so, oh, okay, well
Yep.
then, no, I'm still, here, I'll just, maybe I'm holding it closer or something. So, Max, you said, of the 21 people who currently have COVID, 14 of them were people who were vaccinated? Was that
That's
correct?
correct. That's correct.
Yeah,
That's scary.
Well, Claudia, I've been looking into that. And I would recommend you read something called the base rate fallacy. The reason,
Okay.
the explanation for this is that the number of people vaccinated who come down with COVID may be higher than the number of people who get it who are not vaccinated. But the number of people who are vaccinated is a much bigger pool than the number of people that are not vaccinated. So you always have to look at the denominator whenever you're doing this sort of.
Yeah,
comparison.
okay.
So if it's 14 out of 20,000 versus 7 out of 100, that's an exaggeration.
Yeah,
I think the other important thing we need to look at with the cases, active cases, are how many people are hospitalized, deaths, and who's getting seriously sick, or is it just mild symptoms?
right.
So by and large, those who are hospitalized are people who are unvaccinated. It's not to say 100%, but largely it's unvaccinated. The people who suffer the least harmful effects by and large have been people who were vaccinated. And that's kind of the point, that the vaccine is not meant to be a guarantee against getting COVID. People can please take this comparison in context. It's like with the flu vaccine. You get the flu vaccine and it will protect you against most of the worst aspects of getting the flu. Doesn't mean that you may not get the flu, but it means that you will have a higher likelihood of survival and dealing with the worst aspects of the flu. And also, as a reminder, even with the flu vaccines, which are tried and true, and every year, and everybody's gotten really accustomed to them, about 30,000+ people a year die from the flu. So what we're trying to do is minimize risk and exposure and save lives. That's the bottom line. And I think that's what we're trying to accomplish here.
I would agree with Max, except I would emphasize that many of the experts say they know of nobody who has died from the flu who's been vaccinated. That you're talking, 99.99% of people who get the flu that are vaccinated do fine.
now, are you talking about flu, now, Rich? or-
I'm sorry, not flu.
COVID.
Max got me confused there.
Okay.
COVID.
Now, I don't think anybody who's been vaccinated has died from COVID. They might have died from something else.
Yeah, and they're immunosuppressed, and there are other complicating factors.
exactly.
Yeah.
Yeah.
Extenuating circumstances.
So I think we need to keep that in perspective when we talk about people unvaccinated, causing a problem with the vaccinated people.
Right.
And
No.
I think we just need to keep that in mind that, we're not seeing any deaths from people that are vaccinated, and most of them aren't being hospitalized.
Right, but two vaccinated people sitting next to each other, one of them a silent carrier, is as dangerous as an unvaccinated person sitting next to you.
Wait, say that again. I'm sorry, I lost you.
Two vaccinated people,
Yeah,
one of whom is a silent carrier of the virus,
Yeah.
not sick, but is as dangerous to the other vaccinated person as sitting next to an unvaccinated person. Isn't that true?
Not necessarily,
Okay,
because when you test somebody, you may get a positive test, but yet all you're finding is inactivated pieces of the virus, not the whole virus.
Okay,
May not be able to transmit the condition.
okay.
Also, something too that I've been, maybe, Rich, you can help me with this. I've been hearing a lot that people that had got COVID and had the natural immunity have a better, that's a better tool to fight COVID than the actual vaccine. And I've also heard that it could be dangerous for someone to get a vaccination if they've already had the COVID.
I
Yes.
would say no to both. That what I,
Should get vaccinated because the vaccine protects against the more recent variants. So if you were infected with the alpha form early on, the antibodies that you have are not as good at protecting you against Delta. And so,
So do they have vaccine for just the Delta?
well, the vaccine is producing antibodies that work reasonably well against Delta. Because the vaccine is not a perfect form of the alpha form originally. It's modified to produce maximal immune response. So for instance, the virus has to change shape to enter the cell. And the vaccine is, the mRNA vaccines are engineered to be in the open form, basically. And that increases the antibody response against the active version of the virus. So
the
that's the reason.
recommendations are people who have had the virus should still get
Yes,
the vaccine.
Definitely.
And it's not causing any problems.
right.
Thank you.
Well, where are we?
So with regard to recommendations to the schools, I think, it'll be really interesting to see how broadly DESI makes recommendations. I suspect they're going to punt to the local communities, but I don't know that for a fact. What have they done to date?
Onto local communities, to a certain regard. It's been an interesting mix match prior to this. So during the school year, different entities in government had different portions of rules and regulations that were enacted, so that you had parks and parks department, having their own recommendations. People, forgive me, it feels like it's a million years ago now, when this was actually my life for several months. Let me just say it by this without mixing up issues, but different state government entities had different requirements. A lot of them were in relation to sports activities, et cetera, regardless of the school stance on things. So outdoor sports, baseball, softball, that kind of thing. So then they had to meet those standards. People had to meet those standards. Most of what I remember the schools having to deal with has been in relation to distancing while inside classrooms, if they're maintaining inside classrooms, how to deal with lunches, how to deal with wearing masks, because there was a mask mandate at that time. There's nothing unusual in that particular regard. What to do with teachers, what mandates for teachers and that sort of thing. So everybody had a piece of the pie in that, and long and short of it. And so, yeah, we'll see what they have to say. This is a completely different scenario because before there wasn't an available vaccine. There wasn't anything available, especially to kids 12 and up. And we know a lot more now, but the Delta variant is a bit of a game changer. It is highly, and it's affecting that population quite a bit. So we'll see.
Max, do you know who makes up this board of DESI? to make these decisions?
Oh, you know, it's an excellent question, Fred. I don't. I can find that out for you, though.
Be helpful. Where do they get their opinion from?
Well, they do say that they get their, they work their recommendations with the department, the public health department, state public health department. So,
Boston?
state of Massachusetts, yeah, Boston.
Okay.
Yeah.
And yet the
I
governor's,
think it's time that we try to pull this
Go ahead.
all together, as Claudia mentioned.
Rich
My
said,
suggestion is we need to look at a couple of different scenarios. I think we should be making recommendations, not mandates at this juncture. And we need to see what happens in town. I think we should schedule a meeting for next week, because this is moving fast. It's easier to cancel a meeting than have Max run around trying to get one set up for us.
Yep.
I would say that we should make a recommendation for the schools, and we should make a recommendation for the public situation without mandating anything.
I agree.
I agree.
So when you say recommendations for public, do you mean city offices and buildings?
I would say for the rest of the world besides schools.
Okay,
My recommendation would be for schools, because there's so many people that are not vaccinated for various reasons, that currently they should be wearing masks.
I
I
agree.
think for the general public, that if everybody is in a situation where everyone has been vaccinated, such as an office where everyone's been vaccinated, masks are not necessary. If there's exposure to people who have not been vaccinated, then everyone should wear a mask.
Agreed.
Yeah, if you're in an environment where you don't know the status of people, wear a mask.
Right.
Absolutely. Absolutely.
And I would make those recommendations and not mandates at this
Yeah.
juncture.
Agreed. Rich, you're thinking August 19th, 1 week,
Yes.
5:30?
if we can make
Sorry,
that,
I won't be around.
Bummer. How about earlier in the day, Joe?
Earlier in the day might work. Let me just see.
What day?
What
we
did I
talking,
miss?
Fred?
that would be a Thursday,
I
Rob.
gave you 3 committee assignments, Claudia.
What's that?
Who made you king while you were gone?
Is it possible to make that meeting? at
Oh, about
6
the
instead of
school
5?
committee meeting?
Say it again, Rob?
Is it possible to make that meeting at 6 instead of 5:30, or is Joe checking to see if he can do it earlier than 5:30?
Actually, I couldn't do 6 o'clock either. I have a 5:30 meeting I need to be at, unfortunately.
We could make it 6:30.
Or how about first thing in the morning,
Well, the morning certainly works for me.
like 8:30?
Yeah, well, I can do that. Yeah.
Sure.
6
We're
a.m.?
talking about any meeting for the schools? Is that,
No,
what this is?
we're talking about scheduling another meeting, so we have it in place if things change. If they don't change,
Okay,
we'll just cancel the meeting.
Yeah. Rather than trying
Okay.
to schedule one on the fly.
Okay, I'm covering the plumbing inspector right now, so I'm like burning the candle at both ends. So during the day, it's
Tough. Yeah.
tough for me.
But first thing, can you do?
7?
No.
No,
I'm sorry, but, so we're talking about the next meeting. What was suggested? I'm really sorry.
We wanted to have a meeting to, just to discuss, since this thing's moving so rapidly.
Yeah,
to
yes.
Just go ahead and schedule a meeting for next week as opposed to
Without
Max trying to figure out.
Agenda at this point. We can
Yeah.
put one together if need be, and we can cancel a meeting if need be, but we'll have it up.
Right.
So,
So we can't do it on Thursday at regular time?
no, well, I can't come,
And
I'm
anytime, Joe, or just in the evening?
just in the evening. Just, and early afternoon as well, actually, between,
I am booked all day. I work all day
Okay.
until
how about Friday?
4 o'clock.
Friday?
Friday, we're doing these interviews, right?
Friday, which is something I want to talk about under concerns of board. We have a lot about that to talk about. Well, we could, depending on, how many interviews, we could try to fit it in Friday too.
Yeah,
I'm pretty flexible. I can do it anytime.
If we made it at 5 on Friday, that would be more convenient for me. I have a commitment at 7.
I could do 5 at Friday.
So could I.
So can I.
I can too. But now this is keeping in mind that we're going to be doing interviews during the day.
Yeah, but presumably that's earlier in the day.
Can you do it, Max?
Yeah.
I'll make time.
Appreciate it.
Mhm.
And Max and I will confer probably Thursday to decide whether we need it. We may be able to cancel it
Right.
if
You know what?
things haven't changed.
I'm sorry, Rich, just to be clear, Joe, I just want to make sure that the reason we're doing it Friday is you tell me when your availability is on Thursday again.
In the morning, between as early as you like until 2 or 2:30.
And then from 2:30.
I work from 8 until 4.
Okay.
I
all
work
right,
from
so
8 until
Friday, I
4
was
that
just
day.
trying to. avoid
Actually,
that.
I have to leave for Boston. I have a 10 o'clock in Boston, so.
Okay.
So 5 o'clock a week from
Friday.
tomorrow.
Yep.
Okay.
the 20th. Okay,
If we need a meeting the week after, we'll figure that out.
Okay.
Okay, you had a concern of the board, Fred?
No, Claudia,
Yeah, I have 2. The first one, just quick, has there been any, I wanted to know if there was anything that happened with the the navigator position that we suggested a letter be written to Holly about moving that forward. Do we have any information about that?
So by
I'm
way of,
concerned.
yeah, no, that's quite all right. So by way of update, Amy Epstein and I had a long conversation, and it also allowed me some time to look at the grant itself and what it requires, and requires specifically of the department. And when it comes to reporting and attending of meetings with the state, et cetera, et cetera. And I recommended, Amy actually agreed that probably the best thing to do, all things considered, is to move the grant over to another organization. So a little bit of a background on this is that we're suffering from our own success and from Amy Epstein's wonderful brilliance in grant writing. She saw a need because a lot of grants were coming due for her program. She wrote 5 grants and thus far has received 4 of them. And really, which is wonderful. It's amazing work. It's a huge success. Totally unexpected, because for those who have ever dealt with grants before, you tend to write 4 and hope you get 1 or 2. So it says a lot about the work that Amy and her group do. It really would be, in a lot of ways, almost physically impossible for us to do it at this point when we're kind of shorthanded at the top end. And this grant has so many requirements for reporting and monitoring, et cetera. So by doing this, and we've already reached out to a couple of partners who are interested in this, we're not really losing anything. We're still part of the coalition. We still reap the benefits of the work that's being done. We're just not the ones doing all the legwork of management. So, and we're not losing funding for any positions. It was just, we would have housed the position in here. And so, but right now, we're just too thin on the road, really, to do it. So I think, and I did have a conversation with the administration about this, and the feedback I got was that they fully support that move. And so we will keep you posted.
Okay, the reason I ask is I get stopped on the street all day long saying, begging, do you know any mental health person? My daughter needs therapy. My husband needs therapy. And I keep saying there's a position that's coming very soon, who is going to be able to help you. You're just going to be able to call them and they're going to help you find somebody. And I've been saying that to many people. And so is that position going to happen soon? Whether it's
Yeah,
with
it will
another
happen. It's just a matter of making the mechanics of it happen. So in working with the partners who are willing to take those tasks on. One of them is Metro Area Planning Council is very adept at this sort of regionalized work. And another community possibly is interested. So we'll see. But it's being worked through, and I trust Amy to bring it to a successful conclusion.
And the candidate that Amy selected is still available?
To the best of my knowledge, but I don't know that for a fact, Fred. So, but we'll see. And it'll be another organization or entity doing the hiring at that point anyway, but I have no reason to believe that the candidate chosen by the select group at that point, who involved partners, wouldn't choose that person. So, but that's up to them. They have to decide.
Good.
So as you probably all saw, it was on the front page of the Sunday Globe, front article about the mental health crisis, especially with adolescents. So it's just a growing concern, and I was so thrilled to hear. So hopefully it moves along. So sorry,
Yeah.
I just, the other concern of the board is trying to gather us to do the interviews, the first round of interviews for the health director position. And it just seemed like while all of us who were on the quote unquote committee were here, it would be easier to try to figure it out. And so Fred, I really liked your idea, of trying to do several of them at once. Max, you're going to be, but I wanted to try to pin it down. And the other piece is, so we have 7 people that among who everybody's chosen. And Joe, I don't know if you wanted to speak to that. You had a thought about, skills and balancing Max's skills with what we're looking for, and whether some people have the same skills as Max and we, are looking for different skills. You were more eloquent.
Well, no, I mean, that's basically, I was just, when Claudia and I talked about this, I was simply saying that my own personal way of thinking about this is that we have a lot of skills in the department that have to do with inspectional services, septic systems, et cetera, et cetera. And what we lost in both Karen and Kelly was the sort of, if you call it, the clinical side, if you will. That would be a high priority for me, and finding a person that would fill that void and be complementary to Max. And I hope Max would agree that that's something that would make the department a more robust entity with being able to address both sides of the equation, if you will.
Yeah, and just by way of history, peeling back some of the pages, the idea as it was originally envisioned was to bifurcate the role to a certain extent, such that the assistant director's position, as it's deemed now, and the director's position, the assistant director would be in charge of day-to-day operations, ensuring response to public concerns that were the more immediate ones, and then the director's position would be more focused on programmatic initiatives that have been directed by the board and finding funding for those, which in and of itself, as we all know, especially now, and me most in particular, takes a lot of time and energy and bandwidth to be able to focus on. It's a lot of management, and it's a lot of staff just for that role. So I absolutely agree. I think that's the way it needs to be.
Would have been helpful if we'd had that given. I would have made different choices. That job description has changed dramatically, and the way you describe it, that's how the job was advertised.
I think I'm going by when Karen was hired, and the job description then, it was formatted with most of that in mind. I mean, it's good that they have some other skill sets that are more to the core functions of a health department, so the inspectional sides of things. But sorry?
So that they can defend.
Yeah.
the core
Right.
is as a city employee.
Yeah, but in the reality is, Karen was hired for her wonderful and very specific skill sets, and we partnered very well that way. And Karen could handle the things that I didn't want to deal with, and I handled the things that she definitely didn't want to deal with, and it worked out beautifully. So, and I think going forward, that's probably the best practice model that we can use.
Right, and there has been, I'm surprised, Fred, to hear you say that, because there's been a whole history of that. Noreen had no experience with septic, nor did Jack. Our last three directors were more focused on grant writing, on the public health side,
Yes.
about prevention, and not about the inspectional side.
Right. Yeah, I'm looking to improve that. But somebody with a minor in inspectional services with all the skills that Joe spoke of would be an ideal candidate. But a person who understands what people who live in the city expect of the nuts and bolts on the ground, grassroots services that the health department provides.
But also to move it forward in terms of new initiatives around
Totally.
prevention.
Of course.
No, and yeah. So okay,
Things stand right now.
Everyone could take, what's that?
Where do things stand with regard to setting up interviews?
Well, I wanted to wait until I haven't moved forward, because I wanted to have this conversation tonight. And Fred, when you say you would have made different choices, we could decide we could all relook at it and decide by tomorrow. And then I wanted to pin down the times, and then I was going to let Holly know that these are the times. And then after Holly set it up and got their email addresses, Max was then going to do it on some other format you had, right, Max?
Correct.
And we also need to consider that this person is hired by the mayor.
Is that correct? No, I
Yes.
don't think so.
Yes,
At the end of the day, it is, right?
yes.
Well, okay. Yeah, my experience in the past with the last three directors is that we made the choice and we introduced them to the mayor. So are we thinking about doing this differently this
Well,
time?
The city charter is the issue here. All employees for the city, all people who are paid for by the city are hired by the mayor.
Okay.
However,
So do you have a different suggestion, Fred, about how to move forward? Because all I know is how we've done it for the 19 years I've been here.
That's why I'm interested in a person who could also answer issues that the mayor's constituents would have with us of why do I need to upgrade my septic system? And I want to hear from the public health director on that, issues like that are of intense interest to me as chair of septic review. I think the director, if we have the choice, I would like a director who has experience in day-to-day operation of running a health department, who has grown from that, but comes from that.
Okay, then where is Max? Now I feel like we're having a different discussion back to what the job description is. And I guess I thought we moved past that. So I'm a little confused myself now. I mean, we could interview all 7 people that we've chosen and go from there, but I think we need some clarity as a group. And that includes, Rob, that includes you and Rich, who are not quote unquote on the committee, but I'm really confused now.
I think we need to also
We've
be
had
careful. I'm sorry, Claudia, I didn't mean to interrupt you.
No. I
I
was
think-
just saying, somebody else say something.
I think we have to be careful that we should not be making any decisions on items under the concerns of the board.
Right.
This is, if we're going to be making any decisions in the interview process, it's something that should be on the agenda for the next meeting.
Okay, we're not making a decision. What kind of a decision are you talking about?
any sort of decision.
Well,
Yeah.
Max
About
revealed,
Decision
Max
about what
revealed to
time
me-
to have the interviews?
No, that's different. But I'm talking about a decision that really needs to be open to the public.
but Max revealed the bifurcation of the job. And if that's the way things go, then I have less interest in looking for a person who's hybrid, because that's not what he just described. And then we're much back closer to what Joe originally described as being the preferred candidate. And I could then eliminate a candidate or two who were much more strongly grounded in inspectional services, for example, who also showed skills in grant writing and programmatic development and all those other things. But if we're not going to need that, then I'm more, frankly, in your corner, Claudia and Joe.
Mhm.
But it might require 7 interviews.
I think we shouldn't get too hung up on the fact of whether the mayor's hiring this person or not.
Yeah, well, exactly.
We make our best effort at making a recommendation and pass it on to the mayor, and she can.
I would
Right.
agree.
Yeah, that's where I think we got off the track here, Fred, when you brought that up.
Well, the public health director does not answer to the mayor, but has to work with the mayor, and the mayor has to work with the public health director.
Of course.
Well, that's been a model that got clouded, and it ought to be clear. I mean, for example, I would hope that the candidate would read the city charter to understand how to work within city government.
I think we're getting off track here now.
I agree, Claudia. Just to clarify, the director reports to the state on issues related to public health, reports to the mayor in terms of issues of staffing and personnel.
Exactly.
So Claudia, you suggested that you get perhaps a changed list or the same list.
Well, if anybody feels like they wanted, well, Fred said, oh, if I had known that, I would have made different choices. So I'm saying if you want to change your mind, it's not
But
too
it's
late. We haven't,
Only
that's
there,
all. My choices. And so I just took everybody's choices and Max's choices, Joe, Fred and mine. So
I understand. So I'm just concerned that we not delay things too long.
I agree. I agree.
Friday is a special day in the city's week. So will Claudia be able to communicate with Holly tomorrow, Max?
As far as I know, Holly's in the office, yes.
All day or until?
Well, from 8 a.m. to 12:30, as far as I know, yeah, that's a typical city day on Fridays.
Right.
Okay, and so Max, you aren't available to start the interviews till after 11, is that correct?
Well,
Or
it's just
you
that
have to-
1 hour I'm not going to be available, but I'm available around either side of that. Yeah.
But you have to travel somewhere and back?
I have a site visit that I need to do to support staff on a kind of complex enforcement issue in Magnolia.
So
I have a
you
10
have to leave
o'clock
at
that I can
9:30
move.
then.
I have
What's
a
that?
10 o'clock, I have a 10 o'clock at the senior center, but I can move that.
Okay, I think we should start at 11 then and
That's
just,
perfect.
and,
I think I can pull 2 people, and I will communicate with you offline.
yeah, okay, that's great.
All right, should
That's
we
great.
have a motion?
Because I
to
really was
adjourn?
trying to include everybody. That's
Okay.
everybody's choices. But if you do that and let me know, that means we have 5 people. I think we can take care of it all on Friday.
Cool.
Yeah, assuming they're all available, of course. Okay.
Right, but these are gonna be Zoom meetings.
All right.
And, and people pretty much, if they're interested in the job, I know if I was interested in the job, I would rearrange my schedule. It'd be one thing if I had to travel somewhere, but to just get on the computer,
Right.
Okay.
All right, so I'll hear from Fred and then I'll communicate with Holly. And when she sets them up, I'll ask her to get their email addresses, and then I'll give the email addresses to Max because he's gonna set it up in some Google something.
Google Meets, yes.
Okay.
Google Meet. And we're gonna all be together in the CADA training room.
Yeah, that's good.
Max, right, that you had said, yeah,
Yeah, we can do that.
Great.
okay. Okay, that sounds like a plan. It was just much easier, sorry, to do it under consent of board than trying to be communicating with
Can we have
everybody
a
separately.
motion to adjourn?
Fred had a concern.
No,
Oh,
thank you. No, I just wanted to get it on the agenda.
okay, okay.
Yeah.
Okay. Motion to adjourn?
Second.
All in favor?
Aye.
Aye.
Bye.
Bye.
All
Okay,
right,
thank
we'll-
you.
we'll See you
Thank
in
you,
a
everyone.
week. Bye.
Thanks, everyone.